friends. It's Dr. Chan here. Today we have a great interview. I've got Dr. Sunjay Paul. He's a physician located in London with a special interest in tech. So I'm just going to have him introduce himself and kind of tell us a little bit about what he talks about on his channel. Dr. Paul?
Hi, thanks for having me. So I'm a doctor based in London, in England. I specialize in general practice, so the equivalent in the US, I guess, would be a family doctor. I've got a keen interest in technology and also in medical education. So I actually started my own channel on YouTube last year with my focus really on those three things, to try and share my passion in medicine, healthcare, technology, and educating people on these things. So thanks for having me on today.
Of course. Yeah, so I'm excited to just ask you a few questions. My wife bought me like a Oculus for Christmas, and so I've been playing around with it and been hearing a lot about this Metaverse thing. And so just wanted to kind of pick your brain and kind of see what your thoughts are on this stuff. So for those that aren't too familiar to the space, can you tell us what is the Metaverse?
Yeah, of course. I guess it's a big buzzword in technology at the moment, and it doesn't mean a lot to a lot of people right now, but it's being touted as the next big thing. So over the next 5 to 10 years, we're going to hear a lot more about this. Essentially what it is the 3D immersive digital world that the big tech companies envisage us living in. So for example, right now we access the internet through your phone, through your laptop, through your iPad, right? And you go into a website and you access all kinds of information, right? You can speak to a doctor, for example, but you can watch videos, all that kind of thing. Whereas in the future, the big tech companies are assuming, are hoping, are betting that people are going to start actually interacting with each other in digital 3D worlds. So for example, using virtual reality or augmented reality headsets, like the Oculus Quest that you've got. So I guess instead of accessing all of this through a device, through a rectangular shaped screen, the idea is that you'll be able to look all the way around you and feel and see things in 3 dimensions. So instead of just talking to someone through a screen on a phone, you'd actually be able to feel almost their presence because they would be visually right next to you. So that's the basic concept behind the metaverse.
Have you seen any examples of like virtual reality or augmented reality already being used in the healthcare setting?
Yeah, so there's plenty, and some really interesting use cases at the moment. So to give a couple of examples for surgery, that's something that seems really fascinating. For example, in I believe it's the University of Connecticut. So in their medical center, they've been training orthopedic surgery residents in using these Oculus Quest devices. And when they're performing some surgery, they can project essentially the patient's bones, their anatomy, and they can practice before they actually see the patient, right? To give another example, I think at the Johns Hopkins neurosurgeons, so they actually performed their first ever live actual surgery on a patient using an augmented reality headset. So essentially they've got a screen that projects onto a patient and can see exactly where the bones are, the vertebrae in the spine. They can see where the nerves are, where the blood vessels are, and it's like having, Google Maps on your patient is how they described it. So a couple of really interesting uses already, and lots more.
That sounds pretty awesome. Do you think this technology is going to be accessible to everyone, or will some patients be alienated by virtual reality, augmented reality?
Yeah, I guess that's a big question. So I think at present, the fact is that not many people own virtual reality or augmented reality headsets. So at the moment, there's a couple of big manufacturers for this. For example, Oculus Quest, that's owned by Facebook, Microsoft have their own device, a couple of other companies have these, but they're not commonplace. But the metaverse is something that will become much more common in the next 5 to 10 years. That's what companies like Facebook are betting on. So while at the moment it seems like a pipe dream, they are definitely heavily betting on the fact that this will be something that is accessible to everyone in the same way that you might have thought about in the past, right? Let's think about 50, 60, 70 years ago with telephones, right? So I'm sure at the time people said that phones weren't going to be a popular thing. And then that became, something that became everywhere. Everyone had one. In the next generation, you could say the same thing about the internet. You could say the same thing about smartphones. So whenever there's been a really incredible use of technology that technology companies bet heavily on, it always feels like it's going to be something that only the privileged few that can afford these things are going to use. But the idea is in 5 to 10 or maybe 20 or 30 years, this is something that theoretically anyone could use. In terms of alienating specific groups, I mean, the obvious example that most people would give for any kind of technology are, people who are maybe not as comfortable with using new things, maybe older people. But actually, again, to give a specific example of how this could be used, there are actually virtual reality headset games interfaces that are used for patients with dementia. So they're used for patients in a care home, for example, and they have a number of virtual worlds or scenarios that they can enter in. And already these have shown some really positive results. So showing them a familiar location from their childhood or a safe setting, for example, a church or a park or a beach. And you can imagine for someone who's in a care home who's been stuck there for many years, who doesn't get to go out much, it can actually be really liberating for them. And it's shown to improve their mood, actually improve memory recall as well. So while on the face of it, it might seem alienating to everyone, actually the idea is, and I think it's likely that actually this is something that would be accessible to everyone eventually.
Sounds pretty encouraging to hear. And then, like, as you think about like your own practice of medicine, like how do you think your health appointments might change in the metaverse compared to kind of what you're doing now?
Yeah, of course. Yeah, at the moment I am. So I guess we've all seen a big shift because of the pandemic. So I think in the UK, for example, pre-pandemic, about 80% of the consultations that we did were in person, face to face. And because of the pandemic, that proportion shifted to only about 40% or 30% or less in some cases of face to face, and all the rest with phone call or video. And even now, into the second or third year of the pandemic, we're seeing that proportion of face to face actually remaining quite low to about 30 to 40%. And I think the fact is that when we think about the metaverse and the potential future use of these virtual reality headsets in a clinical setting, I think it's going to be certainly beneficial to patients. In terms of how we would use this and where it fits in when we think about phone, video, and in person, I think it's more of a replacement for the phone and video, right? There are obvious scenarios where you may want to see someone in person as opposed to a phone, video, or virtual reality. But you can think of the transition from phone to video being a massive helpful step for patients so they can have that eye-to-eye contact. And the idea is that with virtual reality, I'm certain that it will be, again, a way to advance and evolve the consultation. So I think it's a replacement for the remote consultation, phone and video, and rather than a direct replacement for the face-to-face.
And then, do you think it's physically important to touch patients?
I think it is, and I think while there will always be certain things that are easy to deal with remotely, for example, like a medication review, just a check-in, a follow-up after you've made some sort of intervention with a patient, there will always be important times when you need to see a patient in person, whether that's to break bad news, whether that's to actually examine someone. So someone who comes in with abdominal pain, you can't just diagnose that on the phone, unfortunately. Most of the time you're going to have to put your hand on their stomach. And there's a number of situations where the importance of touch, the physical touch is going to be important. So I think that it's not going to replace that, but it will hopefully augment these remote consultations. Having said that, I think when we look to the future, in terms of how we'll be practicing medicine in maybe 30, 40 years, it might be that our reliance on clinical examination skills itself maybe is reduced. Maybe with increased availability of cheap and accurate scans, maybe we'll be relying less on examination. I know that even in our generation, we tend to rely more on things like testing patients with scans than I'm sure the previous generation did, just because of ease of access, right? I don't know what your experience of that is yourself.
Well, anything else that you kind of see happening with tech and medicine that you kind of wanted to share about?
Yeah, so I mean, again, to go into a couple more examples of how we're using virtual reality. So for patients with pain and particular chronic pain and even with burns, we know that by giving patients a headset with certain software, with a virtual reality system, we know that they experience a lower level of pain. So using this as an adjunct to our standard medication to treat pain is a really useful and interesting use case, because we know that for chronic pain, in truth, tablets are not always the best thing, and it can lead to addiction and not always treat the issue itself. So by targeting the neurological, psychological aspect of this, by using a virtual reality headset, we're already seeing benefits. To give another example, which is also really powerful, and one that you could feasibly imagine. So there's a example with war veterans who experience PTSD. So by using, again, virtual reality headsets, by exposing them to an environment, for example, in a war zone that they may have been in before, instead of that situation inducing the same level of fear and panic and stress, they can acclimatize themselves. So at the moment, the way we treat PTSD sufferers is with graded exposure to that. But for example, for war, that's really hard to do, right? But with a virtual reality headset, you can imagine how that would be a really good way of demonstrating that and exposing them to that environment that maybe has caused them trauma in the past, but something that they could become used to and hopefully overcome. Yeah. So another example that I found really interesting was for actually patients who've had a stroke. So of course, people with strokes are left with a neurological deficit, so they have weakness in their arm or leg, for example. But we know that rehabilitation is the cornerstones of treatment. So by using some virtual reality platform, we can get people to practice these things at home, because we know that physiotherapy makes the biggest difference. And if you can do that on your own, in the comfort of your own home, that is the most important step to your recovery. And at the moment, if you can imagine, someone has physiotherapy maybe 3 or 4 times a week after a stroke. This is something you could do every day in the comfort of your own home. And going along, perhaps less clinical uses, but in terms of general health, we've seen already a massive boom in use of health technology in terms of fitness, right? So there are videos online of people doing workouts, and people are really getting involved in that, especially during the pandemic when gyms were closed. But imagine that you could do these workouts again with a headset, but you could see other people in front of you and follow along. It's just another immersive way of promoting health, really. So I think that's definitely something that's going to become a lot more commonplace, just as we've got used to using, watching workout videos on YouTube or on Apple Fitness Plus, for example. I think we're going to see a lot more of these kinds of fitness programs with virtual reality.